it's a mixed bag. There's a lot of positives and there's some negatives. On the plus side, if you want to roll back entitlements, the phased out approach is the way to go. You want to give people time to be able to adjust to the new world, and the phasing out of the Medicaid expansion opportunities is a way to do that. A second positive, I think, is healthcare reform is really complicated. The ACA got it wrong in a lot of dimensions. A one-size-fits-all sort of Republican alternative proposal would get a lot of it wrong. So one of the really good things, I think, in the proposed legislation is that there's a lot of state flexibility both with respect to Medicaid and with respect to how they deal with the individual insurance market through exchanges and whatnot. On the negative side, the legislation eliminates a number of taxes, and some of those taxes were truly ill-conceived. But having said that, it isn't clear that the Senate proposal is able to sort of cover the costs of the coverage that they're proposing. I guess we have to wait to see what the Congressional Budget Office and others have to say about all of that. There are an awful lot of similarities. Both the House and the Senate are sort of moving in the same philosophical directions. The big difference that I see, and I think it's a real plus, is that the Senate bill returns to the ACA model of basing the subsidies and the exchanges on one's income. So the lower your income, the bigger the subsidy. The House bill scrapped all of that and replaced it with subsidies that were based on age. The older you were, the bigger the subsidy. You really do want to, if you're going to give subsidies, you really want to do it based on need. And the Senate bill sort of moves back in that direction. That's a good thing. I do have one, I think, kind of major concern about the Senate bill too, and it exists to a lesser extent in the House bill. And that's that what the legislation does is it eliminates the mandate to purchase health insurance, but it also prohibits the use of medical underwriting in setting premiums. On one hand, that's all well and good, but what that effectively does is to convert the exchange policies into a single high-risk pool. Because if I'm not required to buy coverage, I'm only going to buy coverage if I need it. And so it's sort of still too early in the digging through of the bill to see whether or not the Senate has imposed some limitations on the ability to just buy coverage when you need to. But it really has the potential to convert the insurance plans and the exchanges into simply those for high-risk folks. I'm not convinced that the repealers and the replacers can both be satisfied out of this piece of legislation. So yeah, I honestly don't know. I guess the good news is if the predictions are true, we'll know in about 10 days.
The Senate's version of the repeal and replace, the Better Care Reconciliation Act that was the draft that was released today, is deeply concerning for a number of levels. The intention of the Senate version as compared to the House version is that it would be less mean, that it would be gentler, that it would give a softer landing to states so they'd have more time to adapt to the cuts. But the cuts are draconian. There's $834 billion the Congressional Budget Office estimates in cuts in the House version. There'll be more higher cuts in the Senate version of that because it links to the Consumer Price Index overall rather than the Consumer Price Index for medical. So when you're taking almost $1 trillion away from state Medicaid programs and federal funding over 10 years, it's going to disproportionately affect those populations that are most vulnerable. And what I'm particularly concerned about is this isn't a softer landing for states. This is still a crash landing for states. And they will permanently undermine the infrastructure of state Medicaid programs by these cuts. The part that's worse in the Senate version is that there's steeper cuts to the Medicaid program. The Congressional Budget Office analyzed the House version, and that was $834 billion in cuts. The Senate version would be higher than that. We'll see what the Congressional Budget Office scores it at next week. But in my estimation, because the Senate version links a per capita Medicaid payment to the Consumer Price Index rather than the Consumer Price Index for medical services, That's about half the increase each year using the CPI. So what that would translate to is $5 billion less per year to state Medicaid programs, which translated over a 10-year period would be about $50 billion additional cuts in addition to the $834 billion over the next 10 years in the House version. There were some provisions in the Senate bill that are better on the health insurance marketplace that make it their intention was to create a softer landing. They delayed some of the provisions even in the Medicaid cuts for a year with the idea in mind that that would be a softer landing, give states more time to adapt to those cuts. In my view, this is still a crash landing that seriously damages a state's ability to run its Medicaid program.